Hello everybody, I'm Danny the dietitian, and this video is going to be about reviewing the medications you need to know for the RD exam. Here is a full list of all the types of medications you need to know for the RD exam, but in this video we're just going to go over the acid suppression medications. We will also review the differences between these medications, the clinical considerations, and then at the end I have 3 practice questions along with the answers and the rationale. And real quick, here are some of my credentials. I am a registered dietitian nutritionist. I'm licensed in the state of Illinois. I have my master's degree in business and administration, my bachelor's of science in nutrition and dietetics, and currently for work, I have a 9-to-5. I'm a clinical dietitian. And the reason I decided to start making these RD exam videos is I really wish I had these type of YouTube videos available when I was taking my RD exam. Videos that are dietitian focused. So if you want to see more of these videos, go ahead and like and subscribe. And you can also leave a comment with maybe like a topic suggestion, and I'd be happy to make a video about it. So what you're going to need to know for the RD exam is each type of these medications, their class, and specific medications to know for the RD exam. We'll go over those. And then especially the nutrition-related side effects and understanding those. These are the 3 acid suppression medications you will need to know. 1, the H2 antagonists. 2, the proton pump inhibitors, or PPIs, and the antacids. And below each of these are the medications that you'll need to be familiar with. So under H2 antagonists, we have famotidine Pepcid, commonly known Pepcid, and under the PPIs, so the brand name is Protonix, the generic name is pantoprazole. And then we have Prilosec, that's the brand name. The generic name is omeprazole. And I see these 2 in my patient's notes all the time, very common, so get familiar with these 2. And then the third one, Nexium, generic name esomeprazole. And then the last one, antacid, just that's the common antacid. Okay, so the type of medication is the acid suppression medication. The class is the H2 antagonist. And this medication decreases acid produced in the stomach. H2 antagonists are medications that block histamine receptors in the stomach lining, reducing the gastric acid secretion. Famotidine, don't know how to pronounce these, doesn't matter. Commonly known brand name is Pepcid, is a widely used H2 antagonist. So let's put our dietitian hat on because that's the type of thinking that you're going to need to know for the exam. So when we think of decreased acid in the stomach, who is this for? Who would this benefit? So reduced stomach acid would really benefit someone with GERD, right? Because they have acid reflux and that acid is going up into their esophagus. So if there's less acid, then it would be less irritating. It also is going to benefit someone with a peptic ulcer. Let's think about this. Why? Ulcers are irritating. There's more acid. It's going to be more irritating on the ulcer. So they would benefit from acid suppression medication. Gastritis, inflamed stomach. More acid, more irritation. Less acid, less irritation. So acid's irritating, so medications like acid suppression will alleviate their symptoms. Okay, so my tip for you is to think about how. How does this medication work? What are their mechanisms? Thinking about how the medication works will help you pass the exam. That's the type of thinking you want. You don't want just the answer. You want to know how to think about these things, how to think through the process. Okay, the more we know about this medication, the better you're going to remember it for the exam. So the H in H2 antagonists means histamine. This medication, which is a histamine H2 receptor antagonist, act competitively with histamine at receptors on gastric parietal cells. They reduce basal acid secretion and pepsin production. So by blocking the H2 receptors on parietal cells in the gastric mucosa, the famotidine decreases the production of gastric acid. This helps mitigate conditions like GERD and peptic ulcers. Okay, so you can see on this little diagram here the gastric cells, parietal cells on the outside, the blue, and we have the receptors. So usually histamine, what do we think about with histamine? It's reactive. So histamine gets in there, it's doing its thing, it's increasing the stomach acid in the stomach. So the histamine is green, so the top cell, that's when it's working how it usually does. With the H2 antagonist in the stomach, it's floating on over to that receptor and competes with the histamine. And so you can imagine there's going to be more of that drug taking up those receptors, less acid is made. So again, when things are working normally, the histamine is in these receptors, there's more acid. More acid, the arrow is going up, but the pH is what? It's lower. And when there's more medication in the stomach taking up these receptors, there's less acid, and the pH goes up, becoming less acidic and more basic. So now that we understand the medication's mechanism, now we can think better about the nutrition-related side effects, which is the important part and what you need to know for the exam. So the nutrition-related side effects decreases B12, iron, and calcium absorption. So let's really think about those. The second one, magnesium and aluminum interfere with the medication absorption. This is what we need to know as dietitians. So let's think about why B12 absorption would be decreased with this medication. Well, we know vitamin B12 in food comes down into the stomach, and to get it out of the food, we need pepsin and stomach acid to unbind it from the food so it can later be absorbed in the small intestine. Well, what did we learn from what this medication does? It reduces the acid in the stomach and the pepsin. So it only makes sense that we wouldn't have as much B12. Okay, so now we're wondering the same thing about iron. Why is iron absorption decreased with this medication? Well, iron comes down in food as well into the stomach acid and needs stomach acid to be converted to a more absorbable form. So it starts coming in as ferric iron, Fe3+, and the stomach acid helps it become ferrous iron, Fe2+, so that it can be absorbed in the small intestine. Okay, and then very similar thing with the calcium absorption. So stomach acid helps dissolve calcium salts from our food, making them more soluble and easier to absorb in the small intestine. So a higher pH slows down that dissolving of the salts, so that decreases absorption. Okay, and then the reason why magnesium and aluminum interfere with medication absorption is that they bind with the medication, therefore reducing the effect of the medication, of the H2 antagonists. So a little hint here, maybe that you might see in a question form, is we need to look at what our patients are taking supplement-wise. I'm thinking like magnesium. Okay, now for the other class of medication you need to know for acid suppression medications is the proton pump inhibitors, aka PPIs. So with all these medications, when you're studying, try to remember the difference between how they work, and I think they'll help you remember what they are. Okay, proton pump inhibitors. They inhibit the proton pump in the stomach lining, so effectively shutting down over 90% of the gastric acid secretion. This is what makes the PPIs particularly effective for severe acid-related disorders. The proton pump inhibitors are more potent inhibitors of gastric acid secretion because they irreversibly block the proton pump. And the proton pump is also called the H+/K+ ATP phase pump, and they're in the stomach cells, the parietal cells. So one way that helps me remember the proton pump inhibitors and attach them to the medications is all the P's. It's pantoprazole, omeprazole, esomeprazole, Protonix, Prolox. So if the PPIs result in a significant and prolonged decrease in gastric levels in the stomach, and it's the more potent medication for this, what disease states do you think would be appropriate for this medication? PPIs are used in managing more severe cases of GERD, peptic ulcers like the other medication, but also preventing acid-related damage to the esophagus. like in esophagitis or Barrett's esophagus. So, when it comes to the nutrition-related side effects, with all these acid suppression medications, we do need to think about what the effect of decreased stomach acid has on our absorption of nutrients like B12, iron, and calcium. But the nutrition-related side effects that we need to know about the proton pump inhibitors is that food decreases the drug concentration, food in the stomach, and with long-term use, we can see low serum magnesium, hypomagnesemia. Now, don't just memorize these two things. What we want to do is figure out why. Why does food decrease the drug concentrations? Why with long-term use? And what does it mean if we have low serum magnesium with the use of this drug? So, food decreases the drug concentration. What we need to know about proton pump inhibitors is that the medication directions indicate that you should take the medication before a meal. The reason for this is when you eat, the food in your stomach triggers a snowball effect of all this gastric acid being made. So if you take the PPI after you've already eaten, it's kind of like it's a snowball effect. Like there's already a bunch of acid that has already been made, so you can't really do anything about it at that point if you take the medication after you eat. So the exact mechanism is not fully understood actually, but just remember that with the stomach acid, it helps with turning many nutrients into their more absorbable form, like we were talking about earlier with iron. So my tip here is to make those connections. Make the connection that the PPI long-term use could cause magnesium deficiency, which could lead to various complications, including cardiac arrhythmias, seizures, and muscle weakness. And due to the potential for serious complications with this, it's important to monitor that serum magnesium level as a dietitian in your patients who are on that long-term PPI therapy, especially those with all those additional risk factors. Okay, last acid suppression medication, antacids, which are over-the-counter medications that neutralize stomach acid through a basic chemical reaction, providing quick relief from heartburn and dyspepsia. So this is short-term, for short-term use, not long-term use. Now, common ingredients we see are aluminum hydroxide, magnesium hydroxide, and calcium carbonate. And we'll see this more commonly as Tums, Pepto-Bismol, or Mylanta. So we've talked a little bit about understanding the pH and how these drugs affect the pH of the stomach. So if the antacid neutralizes the stomach, what is happening to the pH? Well, a low pH makes it more acidic. So by raising the pH, that would help it be more neutral. More neutral gastric juices, if it's splashing up into the esophagus, if someone, has GERD or something, would be less painful, less heartburn. And so the key difference between antacids and the H2 antagonists and the PPIs is the antacids, like Tums, do not inhibit acid production. And they're really not meant for long-term use. It's short-term use. Now, for the nutrition-related side effects, what we need to know is it could cause anorexia. And I'm sure you're thinking what I'm thinking, which is like, why the heck would something like Tums cause anorexia? But this is the type of thing that you should be aware about for the RD exam. Why? Let's think about why. And I'm sure you know that we're not talking about anorexia nervosa. We're talking about malnutrition anorexia. So let's think about what we've learned about the acid suppression medications today. Let's think about elemental imbalances. Antacids with aluminum can lead to constipation and may bind to dietary phosphorus, inhibiting absorption. Magnesium-based antacids can cause diarrhea. Now, what happens to people who have lots of diarrhea? Malabsorption, they could lose weight, could lead to anorexia. That's where my thinking goes. Okay, and to further enhance your knowledge of these medications, I suggest that you remember the difference between them. To help you remember these medications, visualize a gastromic defense, where the H2 antagonists act like safety locks, selectively reducing stress, aka gastric acid, to allow for healing. The PPIs act like power switches, turning off the acid-producing machinery entirely. And the antacids are like immediate shields that neutralize acid on contact, but don't stop the acid production. And the last thing is, what does this mean to you as a dietitian? How are these medications going to come up for you? What are the clinical considerations? Make these connections and it will help you remember. So let's make the connection, make a full circle, and look at these clinical considerations. Firstly, recognize that patients with chronic use of these medications may need dietary counseling to prevent nutritional deficiencies. You as a dietitian should monitor for symptoms of deficiency, fatigue, bone pain, etc., and in those long-term users. And of course, tailor those dietary recommendations, encouraging foods that are rich in B12, calcium, and magnesium to balance the effects of these medications. So this is pretty much like long story short. Okay, lastly, I have 3 practice questions at the end here. You can go through, I'm not going to talk anymore, look at the questions at your own time, pause the video, and then the answers are at the end with the rationale as well. But go ahead and like and subscribe if you like my video or if you want me to make more. You can make a comment of what type of video I should make next. There really isn't enough dietitian-specific content out there, especially for studying for the RD exam, so I really would appreciate your support. So thank you so much. And you should definitely pass this along to your other dietetic intern friends and student friends. Okay, happy studying. Bye, guys.